Drug Calculation. The Ultimate Handbook. 2025 by Medical Arts Shop. This book revolutionizes how drug calculation is learned, uncovering the why behind formulas, addressing common pitfalls, and bridging the gap to real-world application. Chapter 1. Foundations of Dosage Calculation. An investment in knowledge pays the best interest. Benjamin Franklin. Welcome to the introduction to dosage calculation. In healthcare, precise dosage calculation isn't just a skill, it's a life-saving art. It ensures patients receive the exact medication they need, tailored to their unique physiology and condition. Dosage calculation transcends mathematics. It integrates critical thinking, anatomy, pharmacology, and real-time decision-making. From adjusting doses for a neonate to delivering high-stakes emergency medications, it demands unparalleled accuracy and adaptability. By exploring this content, you're taking the first step toward acquiring a high-quality knowledge that will empower you on your medication calculation journey. Importance and applications in healthcare. Every milligram administered carries the potential to heal or harm, making precision non-negotiable. This is not just about following protocols. It's about ensuring every dose aligns with the patient's specific needs, promoting recovery while minimizing risks. Certain populations are particularly vulnerable. In pediatrics, dosages must be precisely adjusted to weight or body surface area to safeguard the delicate physiology of children. Similarly, geriatric patients require meticulous care, with age-related metabolic and organ function changes necessitating personalized adjustments. Some drugs pose significant toxicity at any age, making precise calculations essential for the safe administration of high-risk medications, such as insulin, anticoagulants, and chemotherapy agents. Avoiding critical errors, real-world examples. History teaches us that single miscalculation can turn a life-saving treatment into a life-threatening event. In 2019, a decimal point error during IV insulin preparation caused a patient's blood sugar to drop dangerously low, leading to cardiac arrest. Such mistakes, often preventable, highlight the stakes involved. On a different incident, in pediatric care, administering an adult dose of antibiotics to an infant has led to severe kidney damage, emphasizing the importance of weight-based calculations in these populations. A chemotherapy patient was prescribed fluorouracil via an infusion pump at 1.5 milliliters per hour over 7 days. An incorrect pump input of a 5 ml/h flow rate delivered the entire dose in only 46 hours, causing severe toxic effects, underscoring the need for double-checking units and flow rates. And finally, in August 2024, 3 children in Kentucky were hospitalized after taking a liquid form of clonidine, a medication given for some ADHD cases. Severe reactions included ICU admissions and ventilator support. Parents were warned to avoid this medication batch due to potential compounding errors. Exponents in scientific notation. Science involves dealing with large and small numbers. Exponents and scientific notation are mathematical concepts used to simplify the representation of those numbers. Exponents. An exponent is a small number written above and to the right of a base number. It indicates how many times the base number is multiplied by itself. Base number 2, with an exponent of 3, is a simplification of 2 multiplied by 2 multiplied by 2, which equals 8. Exponents makes large or small numbers easier to read and write. Scientific notation helps us represent very large or very small numbers in a compact form. It follows the format: a times 10 to the power of n, where a is the number between 1 and 10, and n is the exponent, indicating how many times the base number is multiplied or divided by 10. For example, the estimated total number of cells in the human body is written as 3.72 times 10 to the power of 13, equaling approximately 37.2 trillion cells. Here, the positive exponent shows the base number expanding to the right. On the other hand, the size of a virus can be represented as 1 times 10 to the power of -7, which translates to 0.0000001 meters. The negative exponent shifts the base number to the left. This notation simplifies handling extreme values, making them more manageable for reading and comparisons. Understanding decimal places. A number that includes a point is called a decimal. For example, 11.456. The decimal point is the dot in the number that separates the whole number part from the fractional part. Each digit after the decimal point has a specific name based on its position. The first digit after the decimal is called the tenths place. The second digit is the hundredths place. The third digit is the thousandths place. In the example 11.456, the digit 4 is in the tenths place. The digit 5 is in the hundredths place. The digit 6 is in the thousandths place. So, decimal place simply refers to the position of digits after the decimal point, and this naming continues for further digits. That's how we define and understand decimal places. Let's learn about BODMAS, a simple way to remember the order of solving math problems. BODMAS stands for B for brackets, O for orders, D for division and multiplications, A for addition and subtraction. Brackets. Solve anything inside parentheses first. Orders, calculate exponents or powers next. Division and multiplication. Do these operations from left to right. Addition and subtraction. Finally, handle these from left to right. Now, let's apply BODMAS to a practical example. A doctor prescribes a single dose of 300 milligrams of medication. The medication comes in a concentration of 200 milligrams per 5 milliliters. How many milliliters does the patient need to take? To solve this, the formula we will use is 300 milligrams divided by the concentration, which is 200 milligrams per 5 milliliters. Step 1, calculate the bracket. 200 milligrams divided by 5 milliliters gives us 40 milligrams per milliliter. Step 2, divide. 300 milligrams divided by 40 milligrams per milliliter equals 7.5 milliliters. So the answer is, the patient should take 7.5 milliliters. Note that in this example, brackets were used for the concentration calculation. Orders or exponents were not applicable. Division and multiplication were performed to find the final answer. Addition and subtraction were also not applicable. This demonstrates how BODMAS helps us solve problems step by step with accuracy. Rounding. Rounding plays a crucial role in drug calculations to ensure doses are practical, consistent, and safe. Rounding is often necessary to match the markings on a syringe or adjust a tablet dose when exact amounts aren't available. Here's the general rule for rounding. If the digit to be rounded is 5 or greater, round up. For example, 5.67 rounds to 5.7. If the digit to be rounded is 4 or less, round down. For example, 5.43 rounds to 5.4. To avoid medication errors related to decimal notation, always use a leading zero for numbers less than 1. For instance, write 0.5 milligrams, not just 5 milligrams, because 5 could be misinterpreted as 5 milligrams. Never use trailing zeros after a decimal point. For example, write 5 milligrams, not 5.0 milligrams, because 5.0 could be misinterpreted as 50 milligrams. By following these guidelines, the team can reduce the risk of dosing errors and ensure patient safety. Precision in rounding is critical, especially in medical calculations. Rounding should always be done at the end of a calculation, not during intermediate steps. Premature or improper rounding can lead to serious consequences, particularly when dealing with small volume, high-potency drugs or fragile populations. Errors in rounding can result in harmful underdosing or overdosing. For neonates or high-risk patients, even small deviations can have a significant impact. For example, rounding 0.75 milliliters to 1 milliliter results in a 33.3% overdose. This highlights why precision in rounding is essential for patient safety and effective treatment. When to round. Rounding is often necessary in medical practice to ensure accuracy and practicality. Here are some scenarios, examples, and the reasons why rounding is applied. Liquid oral medications. Example, Syringes can't measure below 0.1 milliliters. For instance, 1.37 milliliters is rounded to 1.4 milliliters. Reason: safe rounding ensures practical dosing without clinical risk. Tablet splitting. Example: a prescribed dose of 12.8 milligrams is rounded to the nearest half tablet, such as rounding to 12.5 milligrams when using scored 25 milligram tablets. Reason: tablets are not infinitely divisible. Rounding ensures practicality in administration. Adult IV fluid rates. Example: flow rates are rounded to the nearest whole milliliter per hour, such as rounding 124.6 milliliters per hour to 125 milliliters per hour. Reason: minor deviations are clinically insignificant for adults. Neonatal and pediatric V rates. Example: infusion rates are rounded to the nearest tenth, like 4.28 milliliters per hour, being rounded to 4.3 milliliters per hour. Reason: tighter tolerances are required for these populations. Precision is critical, and devices like pumps allow for exact measurements. Doses administered by drops. Example: drop rates are rounded to the nearest whole number, such as 25.4 drops per minute being rounded to 25 drops per minute. Reason: fractional drops cannot be administered, making rounding to a whole number necessary. It's important to note that this table provides practical examples and an overview of rounding in medical calculations. It is not intended to serve as a strict set of guidelines. Chapter 2. Measurement Systems. Did you know that the ancient Egyptians used a system of measurement based on body parts, such as fingers and palms? This fascinating approach marked the beginning of standardized measurement systems and influenced the systems we use today. Measurement units. Healthcare uses various measurement systems to ensure accuracy and consistency. Let's explore 4 key systems. The metric system, the most commonly used system worldwide, based on multiples of 10 and includes units such as grams for weight, liters for volume, and meters for length. The household system, often used for patient instructions at home, includes familiar units like teaspoons, tablespoons, and cups. The apothecary system, an older system, rarely used today but still found on some medication labels, uses units like grains, drams, and minims. The imperial system, primarily used in the United States, includes units like pounds for weight and ounces for volume. For example, 1 ounce equals 28.35 grams, and 1 inch equals 2.54 centimeters. Imperial measurements in drug calculations. The imperial system is widely used in North America, particularly for drug calculations. Key units to know are pounds and ounces. Pound lb, commonly used to measure body weight. Ounce oz, used for both fluids and weight measurements. Important conversions to remember. 1 pound equals 16 ounces, which is critical for weight-based dosing. 1 fluid ounce is approximately 30 milliliters. Why conversions matter. Conversions in medicine are vital for patient safety and treatment efficacy. They enable doctors to prescribe the correct doses, pharmacists to prepare medications accurately, and nurses to administer the right amounts. Errors in conversions can have serious consequences. Too little medicine may result in ineffective treatment, worsening the illness. Too much medicine can cause toxicity or even death. By using correct conversions, healthcare workers ensure each patient gets the right dose to feel better and stay healthy. Conversions between metric units involve moving the decimal point, based on whether you're converting from a small unit to a larger unit or vice versa. To convert a small unit to a large unit, move the decimal point to the left. For example, converting micrograms, mcg, to milligrams, mg. 1,500 micrograms becomes 1,500 milligrams, or simply 1.5 milligrams. To convert a large unit to a small unit, move the decimal point to the right. For example, converting milligrams mg to micrograms, mcg. 1.5 milligrams becomes 1,500 micrograms. The metric system simplifies conversions through consistent steps of multiplying or dividing by 1,000. From nanogram to microgram, multiply by 1,000. To convert back, divide by 1,000. From microgram to milligram, the same rule applies. Multiply by 1,000 to increase units, divide by 1,000 to decrease. Similarly, milligrams convert to grams, and grams to kilograms, each using the same factor of 1,000. This logical progression ensures precision in drug calculations, from the smallest to the largest units. Converting between metric and imperial systems involves simple approximations. Fluids, 1 ounce is approximately 30 milliliters. Weight, 1 kilogram equals 2.2 pounds and 1 pound equals 16 ounces. To convert pounds to kilograms, divide by 2.2. To convert kilograms to pounds, multiply by 2.2. In drug calculations, we frequently use these volume units. Liters, L, which represent larger volumes. Milliliters, ml, commonly used for smaller, precise measurements. Cubic centimeters, abbreviated as cc or cubic centimeter dash, are occasionally used. 1 cubic centimeter is exactly equal to 1 milliliter. However, ml is preferred in documentation to avoid confusion, as cc might be misread as 00. Key conversion relationship. 1 liter equals 1,000 milliliters. To convert, divide by 1,000 to go from milliliters to liters, useful for larger quantities. Multiply by 1,000 to go from liters to milliliters for smaller or detailed measurements. This section introduces common pitfalls and memory aids for quick conversions within and between measurement systems. These include key conversions. Weight. 1 kilogram equals 1,000 grams. 1 gram equals 1,000 milligrams. 1 milligram equals 1,000 micrograms. Volume. 1 liter equals 1,000 milliliters. 1 milliliter equals 1 cubic centimeter, cc. Length. 1 meter equals 100 centimeters. 1 centimeter equals 10 millimeters. For conversions between metric and household systems, 1 teaspoon equals 5 milliliters. 1 tablespoon equals 15 milliliters. 1 ounce equals 30 milliliters. 1 pint equals 480 milliliters. 1 quart equals 960 milliliters. The following 5 pages contain tables that can be a helpful reference. Feel free to print your personal version. Chapter 3. Intermediate Applications. In the Middle Ages, obesity symbolized wealth and indulgence in a world of scarcity. Yet, the visionary scholar Avicenna saw beyond the luxury, warning of its hidden health risks and advocating for moderation. Body mass index, or BMI, is a cornerstone of medication dosing and is used to assess global trends in adult health. The categories include severely underweight, 1-3% of the population. Underweight, 3-10%. Optimal weight, 35-45%. Overweight, 35-40%. Obese, 10-15%. Severely obese, 5-10%. BMI is a critical tool for understanding weight-related health risks and guiding treatment decisions. Body mass index, or BMI, is an indirect measure of body fat that accounts for both height and weight. It provides a more accurate reflection of an individual's size and physiological characteristics compared to weight alone. BMI is used in healthcare settings to assess health risks and plan treatments, evaluate a healthy weight range, screen for weight-related health conditions, offer a quick and simple weight assessment. Practically, BMI is widely used in health and fitness to monitor population trends. However, it has limitations. It does not account for muscle mass, bone density, or fat distribution. It may misclassify highly muscular individuals as overweight or obese. Why BMI matters for medication. BMI influences medication dosing and effectiveness in several ways. Drug distribution. Body composition affects how medications, like insulin or propofol, are distributed throughout the body. For example, patients with more fat tissue may experience different interactions with these drugs. Metabolic rate. BMI impacts how quickly the body metabolizes drugs, influencing their effectiveness and duration. Risk assessment. High or low BMI can indicate underlying health risks, which may affect medication safety and efficacy. Additionally, weight loss medications or treatments for obesity-related conditions are often determined by BMI thresholds. Dosage adjustments. Accurate BMI is critical for determining proper medication doses, especially for pediatrics, geriatrics, patients with obesity or underweight, drugs with narrow therapeutic ranges. How to calculate a BMI using metric system. Body mass index, or BMI, is calculated using a person's weight in kilograms and height in meters squared. The formula is BMI equals weight divided by height squared. Let's calculate the BMI for someone weighing 70 kilograms and standing 1.75 meters tall. First, square the height. 1.75 times 1.75 equals 3.0625. Next, divide the weight by this squared height. 70 divided by 3.0625 equals 22.86. Rounded to one decimal, the BMI is 22.9, which is within the healthy range. For practicality, if your weight is in pounds, convert it to kilograms by dividing by 2.2. Similarly, to convert kilograms back to pounds, multiply by 2.2. The formula for calculating body mass index, or BMI, using the imperial system is BMI equals weight in pounds divided by height in inches squared, multiplied by 703. For example, let's calculate the BMI for someone weighing 150 pounds with a height of 65 inches. First, square the height. 65 times 65 equals 4,225. Then, divide the weight by this value. 150 divided by 4,225 equals approximately 0.0355. Finally, multiply by 703. 0.0355 times 703 equals 2496. Rounded to the nearest whole number, this person's BMI is 25, which is classified as overweight. BMI categories are defined as follows. Under 18.5, classified as underweight. Between 18.5 and 24.9, considered the healthy range. Between 25 and 29.9, described as overweight. Between 30 and 39.9, categorized as obesity. 40 or over, defined as severe obesity. These classifications help assess weight-related health risks and guide treatment planning. For a visual representation, refer to Section 8.5. BMI metric heat map is a quick tool to estimate or verify BMI by aligning weight with height. Listeners can refer to Section 8.6. Body mass index and its health effects vary across categories. Underweight, BMI less than 18.5. Health risks include nutritional deficiencies, weakened immunity, osteoporosis, infertility, and irregular menstruation. Tips: focus on nutrient-dense foods and strength training. Normal weight, BMI 18.5 to 24.9. Benefits include lower chronic disease risk, improved energy and mobility, and joint and muscle health. Maintenance tips: follow a balanced diet and engage in moderate physical activity. Overweight, BMI 25 to 29.9. Risks include hypertension, type 2 diabetes, joint strain, osteoarthritis, and sleep apnea. Tips: practice portion control and increase physical activity. Obesity, BMI 30 or more. Risks include type 2 diabetes, heart disease, certain cancers, fatty liver, gallbladder disease, and mental health challenges. Management includes weight management plans, behavior therapy, and medical guidance. Severe obesity, BMI 40 or more. Risks include life-threatening complications, severe joint and organ strain, and reduced quality of life. Management options include bariatric surgery and psychological support. Chapter 4, Body Surface Area, or BSA. The concept of body surface area originated in the 19th century when German physiologist Carl M. Mee introduced the first formula in 1879, revolutionizing how body measurements were quantified. In 1916, the American duo Delafield Du Bois and Eugene Floyd Du Bois refined this with the now iconic Du Bois formula, blending precision with practicality. Body surface area, or BSA, measures the total surface area of the human body, envisioning it as if the skin were carefully laid out flat. BSA is expressed in square meters and plays a critical role in determining drug dosages, especially for medications with narrow therapeutic ranges or potential toxicity. Compared to BMI, BSA provides a more comprehensive indicator as it considers the body's entire surface area, not just the fat portion. Body surface area, or BSA, significantly impacts medication by influencing drug distribution and the rate at which the body clears medications. BSA-based dosing is particularly crucial in minimizing the risk of adverse drug reactions. This approach is commonly used in chemotherapy, pediatric treatments, patients with burns, and certain antibiotics. Precise rounding of decimals is often applied for practical purposes to ensure accuracy in dosing. Body surface area, or BSA, is an estimate of the total surface area of a person's body. To visualize this, imagine peeling off a person's skin and laying it out flat. The space it would cover represents the BSA. The formula for calculating body surface area, or BSA, using the metric system is called the Mosteller formula. BSA equals the square root of weight in kilograms times height in centimeters, divided by 3,600. Let's calculate the BSA for someone who is 170 centimeters tall and weighs 70 kilograms. Multiply height and weight. 170 times 70 equals 11,900. Divide by 3,600, 11,900 divided by 3,600 equals approximately 331. Take the square root of 3.31, which equals about 1.82. So this person's BSA is approximately 1.82 square meters. The formula for calculating body surface area, or BSA, using the imperial system is BSA equals the square root of weight in pounds times height in inches divided by 3,131. Let's calculate the BSA for Sarah, who is 5 feet 9 inches tall, or 69 inches, and weighs 150 pounds. Multiply height and weight. 69 times 150 equals 10,350. Divide by 3,131. 10,350 divided by 3,131 equals approximately 3.31. Take the square root of 331, which equals about 1.82. So Sarah's BSA is approximately 1.82 square meters. Body surface area, or BSA, is widely used in clinical settings to tailor treatments. Oncology. Chemotherapy dosing is often based on BSA to ensure efficacy and minimize toxicity. Pediatrics. BSA-based dosing is preferred over weight-based dosing for children, as their metabolic rates and organ functions differ significantly from adults. Burn treatment. BSA helps determine fluid replacement needs and medication dosages for burn patients. However, BSA may not be ideal for obese or very lean patients, as it doesn't fully account for variations in body composition. Chapter 5. Dosage calculations. All things are poison, and nothing is without poison. Only the dose permits something not to be poisonous. Paracelsus, 1493 and 1541. Dosage calculations can go wrong. Every year, between 7,000 and 9,000 Americans die from medical errors. Potential harm from dosage errors includes adverse drug events, or ADEs, ranging from mild side effects to severe complications, hospitalization, and even death. Human factors such as stress, fatigue, distractions, and interruptions significantly increase the risk of dosage errors. Formula for dosage calculation. The formula is written as desired divided by half multiplied by a vector equals the amount to be given. Desired refers to the prescribed dose, such as 200 milligrams. Half indicates the available dose or strength, for instance, 50 milligrams per 5 milliliters. Vector represents the medication form. For liquids, it is the volume in milliliters containing the available dose. For tablets, it is typically 1. Meaning the concentration in one pill. For example, if the prescription says, give 200 milligrams, we apply this formula to calculate the required quantity. This simple yet essential formula ensures precise medication administration for safe and effective treatment. Calculating drug doses, quantity required. In this section, we demonstrate calculating drug doses using the quantity required formula that we saw in the previous section. The formula is desired dose divided by available dose multiplied by vector equals the amount to be given. For example, if a prescription states give 200 milligrams and the available tablets are 50 milligrams each, we calculate as follows. Divide 200 milligrams by 50 milligrams to get 4. Multiply by 1, because each tablet contains the concentration 50 milligrams. The result is 4 tablets. This calculation ensures the patient receives the correct dosage for their treatment. Dosage calculations based on weight. People metabolize drugs differently depending on factors like age, organ function, and body composition. Weight serves as a critical indicator of body size and significantly impacts how a drug is distributed and eliminated. For children, weight-based dosing is especially important. Children are not simply smaller versions of adults, and administering a standard adult dose can easily lead to an overdose in a child. Calculating drug doses based on body weight. Use this formula. Dose mg equals weight kg, multiplied by dose per kg. Step-by-step example. A doctor prescribes a medication at 5 milligrams per kilogram of body weight. The patient weighs 30 kilograms. Key information. Dose per kilogram, 5 million. Patient's weight, 30 kilo. Calculation. 30 kilograms multiplied by 5 milligrams per kilogram equals 150 milligrams. Answer, the patient should receive 150 milligrams of the medication. Why pediatric dosing is unique. Children's bodies process medications differently due to the ongoing development of their organs, such as the liver and kidneys. Immature organs. The liver has reduced enzyme activity, affecting drug metabolism. The kidneys have decreased clearance rates, prolonging the drug's half-life. Higher water content. Alters the distribution of water-soluble medications. Smaller fat stores. Impacts the distribution of lipid-soluble drugs. Makes BMI calculations less accurate. Key factors in pediatric dosing include weight in kilograms and body surface area, or BSA. Age, developmental stage, and organ function also play critical roles. Medication safety reminder, always double-check dose calculations and use pediatric formulations, such as liquid suspensions, instead of cutting tablets. Age-related medication dosage. As people age, their body's ability to process medications changes, requiring adjustments to dosages. Decreased renal function. Declines with age, impacting drug excretion and increasing the risk of drug accumulation and toxicity. Reduced liver function. Liver mass and blood flow decrease, affecting drug metabolism and potentially leading to higher drug levels. Altered body composition. Changes in body fat and muscle mass can influence drug distribution and clearance. A key principle in age-related dosing is to start low and go slow. Begin with lower doses and titrate gradually to minimize the risk of adverse effects. Pharmacokinetics. The study of how a drug is absorbed, distributed, metabolized, and excreted by the body. Absorption. The medication journeys from its entry point into the bloodstream. Distribution. Carried by the blood, the medication spreads throughout the body, reaching various tissues and organs. Metabolism. The body works to break down the medication, often in the liver, into a form it can use or eliminate. Excretion. The medication, now altered or inactivated, is removed from the body, primarily through the kidneys. A visual animation explaining these processes is available on our channel. Mid-book knowledge check. A patient with a height of 1.8 meters and weight of 80 kilograms has a BMI of I, 24.7, B, 25.3, C, 26.5, D, 28.2. Don't hesitate to pause to solve each question. Second question. True or false, a BMI of 18.4 is classified as underweight. Now 3. Using the Mosteller formula, calculate the BSA of a patient weighing 50 kilograms and 160 centimeters tall. A, 1.45 square meters. B, 1.48 square meters. C, 1.49 square meters. D, 1.5 square meters. Question number 4. If a medication requires a dosage of 25 milligrams per square meter and a patient has a BSA of 1.6 square meters, what is the correct dosage? A, 40 milligrams. B, 50 milligrams. C, 64 milligrams. D, 80 milligrams. Pause to think about your answers. Medical Arts Quiz number 1. A nurse in a busy emergency room is preparing ceftriaxone for a patient with a suspected bacterial infection. The patient weighs 70 kilograms, and the doctor ordered 2 grams IV to be infused over 30 minutes. However, the pharmacy sent syringes labeled 500 milligrams per 10 milliliters. Question 1. How many milliliters of the reconstituted solution should the nurse administer to deliver the ordered dose of 2 grams? Options: A, 20 milliliters, B, 40 milliliters, C, 50 milliliters, D, 60 milliliters. Question 2. What infusion rate, in milliliters per hour, should the nurse set to deliver the medication over 30 minutes? Tips for solving. Determine the total dose required. Calculate the concentration after dilution. Adjust the infusion rate accordingly. More questions with their answers are found in the book. Chapter 6, Advanced Techniques. The Babylonians, as early as 1600 BCE, used water clocks, an ingenious system to measure time with precision through consistent drips. This ancient method is comparable to the steady drips we depend on in modern IV therapy. These advanced techniques of measurement and timing revolutionized both timekeeping and medical practices. Infusions. Infusion therapies play a critical role in delivering fluids, medications, or nutrients. Precision in calculating and administering the correct infusion rate is vital for patient safety and treatment success. Intravenous therapy dates back to the 17th century, with its first recorded successful use in 1665, marking a milestone in medical advancement. Refer to Section 12.1. It is an infusion reference map, as it visually summarizes all key concepts related to infusion techniques discussed in the upcoming chapters. Infusion rate, different types. The infusion rate is the speed at which intravenous or IV fluids or medications are delivered directly into a patient's bloodstream. There are 2 main types of infusion rates. First, programmed flow rate, measured in milliliters per hour, or mLh. Modern infusion pumps are used to achieve precise and consistent delivery. Notably, these devices did not exist before the 1960s, making them a relatively recent advancement in medical technology. Second, manual drip rate, measured in drops per minute, or drops per minute. This method relies on gravity-based systems and careful calibration of drop size. These systems have been in use since the late 19th century and remain essential in resource-limited settings or emergencies. Understanding these 2 approaches, programmed flow rate for precision and manual drip rate for versatility, is key to mastering IV therapy. Flow rate, volumetric pump. Flow rate refers to a controlled infusion measured in milliliters per hour, abbreviated as mLh. It uses a volumetric pump to administer the infusion. Volumetric pumps are electronic devices that automatically regulate the flow of IV fluids. Common in hospital settings, they ensure precision and minimize the need for manual adjustments. The rate is directly set in ml/hour, simplifying calculations for total fluid delivery over time. In upcoming sections, we'll explore 2 main types of flow rate: intermittent and continuous infusion. Flow rate, continuous infusion. In continuous infusion, the flow rate is prescribed in milliliters per hour, or ml per hour, eliminating the need for further calculations. For instance, an order to run saline serum at 200 milliliter per hour can be directly entered into the volumetric pump. This straightforward approach ensures efficient and precise administration of fluids over time. IV infusion, weight-based flow rate. Weight-based infusion rates are calculated using the formula. Dose is equal to weight multiplied by dose per weight. For example, a maintenance fluid order of 4 milliliters per kilogram per hour for a 15-kilogram child is calculated as 15 kilograms multiplied by 4 milliliters per kilogram per hour is equal to 60 milliliters per hour. We program the pump to deliver the calculated rate, ensuring precise and personalized fluid administration. Flow rate formula. To calculate the flow rate in milliliters per hour, use the formula. Flow rate in milliliters per hour equals the total volume in milliliters divided by the time in hours. For example, if a patient is prescribed 2 liters of normal saline to be infused over 3 hours, first, convert 2 liters to milliliters by multiplying by 1,000. This gives 2,000 milliliters. Next, divide 2,000 milliliters by 3 hours. This equals 667 milliliters per hour. The infusion pump should be programmed to deliver 667 milliliters per hour for accurate fluid administration. Flow rate intermittent. To calculate the flow rate for intermittent infusions, the formula is flow rate in milliliters per hour equals the total volume in milliliters divided by the time in minutes, multiplied by 60. For example, if the prescription states, give albumin 25% in 100 milliliters over 90 minutes. First, divide 100 milliliters by 90 minutes. This gives approximately 1.11 milliliters per minute. Next, multiply by 60 to convert this rate to milliliters per hour. The result is approximately 66.6 milliliters per hour. Program the infusion pump to deliver 66.6 milliliters per hour for accurate administration. Drips. Drip rates are essential in gravity-fed intravenous systems. These rates are measured in drops per minute, abbreviated as GTTS per minute. The term GTTs originates from the French word gouttes, meaning drops. To ensure accurate administration, use a watch to count drops precisely. Adjust the roller clamps carefully to fine-tune the flow. Drip rates are primarily used when electronic infusion pumps are unavailable, making manual accuracy critical. The following chapters will guide you through the calculations, tools, and considerations necessary for effective gravity-based systems. Drop factor. Each intravenous tubing is designed to produce a specific drop size. The term drop factor refers to the number of drops needed to deliver 1 milliliter of fluid. For example, a drop factor of 20 means 20 drops are required to accumulate 1 milliliter. A drop factor of 60 indicates 60 smaller drops are needed for the same volume. Drop factors are typically labeled on the IV tubing package. Macro drips are designed for larger drops, with drop factors like 10 drops per milliliter. This tubings deliver infusion faster. Micro drips, or mini drops, produce smaller droplets, often with a drop factor of 60. This tubings deliver medications more precisely. Drip rate formula. In this section, we calculate the rate of infusion in drops per minute, also known as the drip rate. The formula is drops per minute equals the volume to be infused in milliliters multiplied by the drop factor, divided by the total infusion time in minutes. Here's an example. The prescription is for 500 milliliters of fluid to be infused over 4 hours. Convert the time to minutes. 4 hours equals 240 minutes. Use the formula. 500 milliliters multiplied by 20 drops per milliliter equals 10,000 drops. Divide by 240 minutes to get a flow rate of 42 drops per minute. This calculation ensures the correct infusion rate for the prescribed volume and drops form over the designated time. Chapter 7. In this chapter, we delve into the principles of concentrations and reconstitution. Did you know? Ancient Egyptians meticulously measured and diluted herbal extracts for therapeutic purposes. This early understanding of balancing potency with volume paved the way for modern practices in medicine preparation. Let's explore how these timeless concepts apply to precise drug formulations and effective patient care. Drug concentration defines the amount of active medication within a specific volume, a critical metric in healthcare. Different volumes can have the same strength, as seen with 5% solutions in 100 milliliters or 500 milliliters. We should not confuse different concentration with different volume. Let's break down the different ways we measure concentration. Weight of a drug per volume is typically expressed as the amount of drug in a given unit of liquid. Examples include concentrations like 1 milligram per milliliter, 6 milligrams per milliliter, or 20 milligrams per milliliter. For instance, 1 milligram per milliliter means 1 milligram of drug is mixed in 1 milliliter of liquid. To compare the strength of different volumes, you need to convert them all to their concentration per 1 milliliter. This can be done using the formula. Concentration per 1 milliliter equals the amount of medication divided by the amount of volume. Between the two vials shown, which one has a stronger concentration? Apply the formula to calculate. Here is the solution using the formula concentration of dilution. Concentration per 1 milliliter equals the amount of medication divided by the amount of volume. Let's compare the two vials. The first vial contains 5 milligrams of medication in 1 milliliter of liquid, resulting in a concentration of 5 milligrams per milliliter. The second vial contains 10 milligrams of medication in 10 milliliters of liquid. Applying the formula, 10 milligrams divided by 10 milliliters gives a concentration of 1 milligram per milliliter. This shows that the first vial is 5 times stronger than the second vial. Concentration as a percentage is a common way to describe the strength of a compound solution or mixture. Expressed in the following three forms: percentage volume in volume, %V/V. This indicates the number of milliliters of a liquid in 100 milliliters of total solution. For example, 70% VV means 70 milliliters of liquid mixed or diluted in 100 milliliters of total volume, as seen in the isopropyl alcohol example. Percentage weight in volume, %W/V. This represents the number of grams of a solid dissolved in 100 milliliters of solution. For instance, 1% WV means 1 gram of the solid is dissolved in 100 milliliters of liquid, as shown in the paracetamol infusion example. Lastly, percentage weight in weight, or %WW, describes the amount of solid solute in 100 grams of a solid mixture. For example, 1% WW indicates that 1 gram of the solid is mixed with 99 grams of the other solid components, such as in the hydrocortisone cream example. These percentage concentrations provide a standardized way to describe the composition of various medical solutions and mixtures. Understanding concentration ratios. A concentration ratio tells us how much of a drug is in a solution. For example, 1/1000 means there's 1 gram of drug in every 1,000 milliliters of solution. The ratio has two parts. Numerator, the amount of drug. Denominator, the total volume of the solution. To find the drug's strength in milligrams per milliliter, we divide the numerator in milligrams by the denominator. Example 1. 1/1000 epinephrine. First, we need to convert grams to milligrams. 1 gram is equal to 1,000 milligrams. So, 1,000 milligrams divided by 1,000 milliliters equals 1 milligram per milliliter. Example 2. Epinephrine 1 to 10,000. 1 gram is equal to 1,000 milligrams. 1,000 milligrams divided by 10,000 milliliters. 0.1 milligram per milliliter. Millimoles per liter. Millimoles. Describe the number of molecules or ions in a given amount of a substance. This makes it a measure of molecular quantity rather than weight or efficiency. Liter, represented as L, refers to the volume of the solution. Millimoles per liter, mmol per liter, is used for measurement in both blood tests and medication concentrations. Before millimoles per liter became the standard, inconsistent units caused confusion in global healthcare. Its adoption has drastically improved precision and patient safety worldwide. International units. A unit is defined by a specific biological effect that the substance produces. Medications like insulin, heparin, penicillin, and some vitamins are measured in units. Units often refer to the potency or activity of a substance, especially for drugs where the exact molecular weight or chemical composition is complex or not fully known. It focuses on measuring how effectively the substance works in the body rather than just its physical properties. Milliequivalent. A milliequivalent, mech, is a unit used to express the amount of an electrolyte in a solution. Milliequivalent takes into account both the concentration of the substance and its valence, electrical charge. Common electrolytes measured in milliequivalents include sodium, Na+, potassium, K+, calcium, Ca2+, and chloride, Cl-. Formula for milliequivalent calculation. The formula to calculate milliequivalent is milligrams divided by atomic weight multiplied by valence. In this formula, milligrams is the weight of the substance in milligrams. Atomic weight is the molecular weight of the substance, and valence is the number of positive or negative charges on the ion. Reconstitution Intro. Have you ever wondered why some medications come as powders? What is reconstitution? Reconstitution is the process of mixing a powdered medication with a specific fluid to prepare it for use. Always use the recommended fluid for reconstitution to ensure the medication dissolves properly in the solution, maintains its stability over time, achieves the correct concentration for safe and effective use. Using the wrong fluid can compromise sterility, reduce efficacy, or cause harmful reactions. Some medications are unstable in liquid form, so they are stored as powders. Let's explore the key elements involved in reconstituting a medication. Reconstitution elements: powdered medication or solid. Some medication ingredients are kept as powders to prevent degradation, microbial growth, and to reduce susceptibility to temperature fluctuations and light exposure, thereby extending their shelf life. Liquid diluent, also referred to as solvent. The solvent dissolves the powder to create a homogeneous solution. Common diluents include sterile water for injection, normal saline, dextrose solutions, and specialized diluents with buffers or stabilizers as specified by the manufacturer. Reconstituted medication, we call it the solution. The final liquid medication ready for administration. It is important to verify the stability of your solution, as some should be used immediately after reconstitution. Displacement value refers to the added volume caused by mixing a powder into a liquid. Before mixing, the vial contains a specific volume of liquid. After the powder is added, the liquid level increases due to the volume occupied by the powder. This increase is known as the displacement volume. Why is displacement value important? It ensures accurate dosing by accounting for the space the powder takes in the solution. It prevents over-dilution or under-dilution, which could compromise the medication's effectiveness or safety. It is crucial in preparing injectable drugs where precise concentrations are critical. Displacement value refers to the increase in the volume of a solution caused by adding a powdered substance to a liquid. This value is typically provided on the medication label. The formula to calculate displacement volume is equal to the mass of the substance multiplied by the displacement value. For example, if 2 grams of powdered medication has a displacement value of 0.8 milliliters per gram, how much does the solution volume increase? Displacement volume is calculated as 2 grams multiplied by 0.8 milliliters per gram, which equals 1.6 milliliters. Thus, adding 2 grams of drug X increases the solution volume by 1.6 milliliters. This change can be visualized as the liquid level rising after the powder is mixed in. Safe dosage range ensures that the medication is both effective and safe. The dosage must be high enough to produce the desired effect. At the same time, it must be low enough to avoid causing harm. For example, the safe dosage range of drug Y is between 1 milligram and 10 milligrams. In addition to the amount of medication, safe dosage also depends on timing and frequency. The maximum safe dose of drug Y is 16 milligrams per day. It is safe to administer 5 milligrams 3 times a day, which totals 15 milligrams per day. However, giving 5 milligrams 4 times a day reaches 20 milligrams, exceeding the safe limit and becoming toxic. Timing. Always follow the recommended minimum interval between doses to prevent dangerous side effects. For children, ensure the dosage does not exceed the maximum safe limit based on their specific requirements. Safe dosage range calculation for the drug meds. The safe range is 1 to 10 milligrams per kilogram of body weight per day. Yanni weighs 20 kilograms. Safe range calculation. Minimum safe dose: 1 milligram per kilogram multiplied by 20 kilograms equals 20 milligrams per day. Maximum safe dose: 10 milligrams per kilogram multiplied by 20 kilograms equals 200 milligrams per day. Therefore, Yanni's safe dosage range is between 20 milligrams and 200 milligrams per day. Chapter 8. Complementary chapters. Ayurveda, originating around 3,000 years BCE, utilized dried herbs compressed into solid forms. This practice, detailed in ancient texts like the Charaka Samhita from 1,000 years BCE, allowed for ease of use and extended shelf life. Emergency considerations. Max bolus speed. To rapidly deliver large fluid volumes in emergencies, consider using pressure bags or gravity infusion instead of relying solely on infusion pumps, as pumps may have flow rate limitations. Epinephrine, adrenaline. Epinephrine is available in different concentrations for faster administration. 1 to 1,000, which is 1 milligram per milliliter, is used for intramuscular injection in cases of anaphylaxis. 1 to 10,000, which is 0.1 milligram per milliliter, is used for intravenous administration in cardiac arrest. Solution compatibility with pumps. Ensure the pump you use does not mechanically or thermally destroy the molecules in your infusion solution. Otherwise, use a gravity-fed infusion. But, again, this is not universal guidelines. Always refer to your hospital and department policies. Solid medication forms. Tablets, compressed medication for oral administration. Capsules, gelatin-coated forms containing powdered or liquid medication. Granules and powders. Powders can be for reconstitution, e.g., multi-dose medications, or direct use, e.g., oral rehydration solution. Semi-solid medication forms. Creams, water-based, suitable for large or wet areas of the skin. Example: hydrocortisone cream. Ointments, oil-based, ideal for dry skin. Example: bacitracin. Gels, transparent, water-based, and easy to apply. Example: diclofenac gel. Pastes, thick mixtures combining powder and ointment, used for protective applications. Example: zinc oxide paste. Suppositories and pessaries. Suppositories, used rectally or vaginally, providing local or systemic effects. Example: glycerin suppositories. Pessaries, vaginal suppositories, often used for infections or hormone delivery. Example: clotrimazole. Liquid medication forms. Drops, precisely dosed liquid for eye, ear, or nasal administration. Tinctures, alcohol-based solutions for potent applications. Example: iodine tincture. Extracts, concentrated liquids derived from plant or other active ingredients. Oral liquid forms. Elixirs, clear liquids containing alcohol, less sweet than syrups. Syrups, sugar-based solutions suitable for children. Example: cough syrups. Suspensions, cloudy liquids with insoluble particles requiring shaking before use. Example: antibiotics. Toxicology, key considerations. Every calculation in toxicology involves careful evaluation of therapeutic thresholds, toxic doses, and patient-specific factors like weight, age, and organ function. Key concepts. Toxic dose, TD. The amount of a substance that causes harm. For example, acetaminophen exceeds its therapeutic safety at doses greater than 4 grams per day in adults. Therapeutic index, TI. The range between an effective dose and a toxic dose, which is critical for drugs with narrow margins like warfarin or digoxin. Drug interactions, DI. Combining medications can amplify toxic effects, such as when flagyls used with alcohol. Toxicology, mechanisms, recognition, and management. Mechanisms of toxicity, we will discuss 3 of them. 1. Overdosing, administering more than the calculated dose. 2. Metabolic overload, accumulation of toxic metabolites, such as in methanol poisoning. 3. Receptor effects, overactivation, e.g., stimulants, or inhibition, e.g., opioids causing respiratory depression. How to recognize toxicity. 1. By acute signs, vomiting, seizures, or respiratory distress. 2. By laboratory indicators, elevated drug levels and abnormal liver enzymes. Finally, how do we manage toxicities? 1. Decontamination, activated charcoal for recent ingestion. 2. Antidotes, medications that reverse toxic effects, such as naloxone for opioids or flumazenil for benzodiazepines. 3. Supportive care, maintaining vital functions through fluids or mechanical ventilation. 4. Elimination, techniques like hemodialysis or forced diuresis for severe cases. Chapter 9. Final assessment. This chapter is your opportunity to test everything you've learned about medication calculations. It's designed to help you identify any weaknesses and at what level of the process. Take your time as you work through the questions and remember, accuracy is critical. Okay, let's apply what we have seen in this book. For the audio version, we will take one medical arts quiz. We're focusing on pediatric dosage calculation. Let's get started. A doctor prescribes vancomycin for 5-year-old Jeremy to treat a bacterial infection. Jeremy weighs 80 pounds. Prescription. The doctor prescribes 15 milligrams per kilogram per dose to be administered every 8 hours. Now, here's the first question. How many milligrams will you administer for every dose? Here's a tip to help you out. First, convert Jeremy's weight from pounds to kilograms. Then apply the dose per weight formula. Take your time and calculate. When you're ready, let's move on to the next question. The pharmacist informs you that they have pre-prepared bags of vancomycin containing 750 milligrams. The recommended safe dosage range for vancomycin is 15 to 20 milligrams per kilogram per dose. Your question is, what is the safe range for this medication in milligrams per dose for Jeremy, who weighs 80 pounds? Here's a tip to guide your calculation. First, use the weight conversion formula for the lower limit of 15 milligrams per kilogram. Then, repeat the calculation for the upper limit of 20 milligrams per kilogram. And let's move on to question 3. The pharmacist has sent a vancomycin infusion bag containing 750 milligrams in 110 milliliters of solution. Jeremy's prescribed dose is 15 milligrams per kilogram. Your question is, how many milliliters will you administer for each dose? Here are some tips to guide you through. Use the answer from question 1 to find the total milligrams required for the dose. Apply the formula, desired dose divided by available concentration. Finally, multiply by the volume in the infusion bag. Calculate carefully, and once you're ready, let's move on to question 4 in our scenario. The medication must be infused over 90 minutes using an IV pump calibrated in ml per hour. Your question is, at what rate should the nurse program the pump? Here's how to approach it. Use your answer from question 3 for the total volume to be infused. Apply the formula, volume divided by time to calculate the flow rate. Take your time to work it out, and when you're ready, continue to the next section of our little quiz. Let's move to question 5. Pump malfunction. The IV pump has malfunctioned 70 minutes before the end of the infusion. The pump shows that 33 milliliters of medication have already been infused. To continue the infusion, you will switch to a gravity-fed system using a drop factor of 20 drops per milliliter. Your question is, how many drops per minute will you run the drip to finish the dose on time? Here are some tips. First, subtract the infused volume from the total volume to find out how much is left to infuse. Divide the remaining volume by the time left in minutes. Finally, multiply by the drop factor to calculate the drip rate in drops per minute. Take your time to work it out, and when you're ready, move to the next section for the last obstacle. Once the infusion is complete, Jeremy can finally have the IV disconnected and head to the playroom. But before we wrap up, let's double-check one last question. After setting up the correct drip rate manually, do you still have other concerns about the treatment? Could anything we did affect the treatment or patient safety? Select your answer, yes or no, and say why. Listeners with the ebook has a hint at the bottom of this page. The first person to answer this simple question correctly in the comments section below will win a $20 USD gift card. The second person will get the ebook for free. If you have already purchased it, then we will grant you a full refund. Don't hesitate to share and ask your friends who are doctors, pharmacists, or nurses that could help you be the one winning. We hope this audiobook provided valuable insights to support your journey. Don't forget to grab your copy of the ebook for lifetime access to updates and ever-expanding quizzes. It's your way to stay ahead with the latest developments. We'd love to hear your thoughts, share your suggestions for future topics, and let's create content that truly matters to you. If you found this helpful, please share it with your colleagues to spread knowledge and encourage more resources like this. Stay curious, stay inspired, and see you in the next update.